Everyone, thank you for joining us today for the webinar that's part of the Research in Progress webinar series on preventing adverse childhood experiences and child maltreatment. Glad you could join us. Today's topic is evaluating organizational policies to prevent sexual abuse. I'm Sarah Brandspiegel. I'm an instructor at the Colorado School of Public Health, where I work with the Program for Injury Prevention, Education, and Research, also known as PIPER. And I facilitate the National Peer Learning Team on Child Maltreatment Prevention, which is a national network of people working in public health and social services who come together to learn about primary prevention approaches to child maltreatment. The NPLT is funded by the Centers for Disease Control and Prevention, and it's a partnership of PIPER at the Colorado School of Public Health and the Colorado Department of Public Health and Environment. And we are so excited to host the third in a series of Research in Progress webinars today. And as I said, the focus is evaluating organizational policies to prevent sexual abuse. Before I get started, I want to do a little bit of housekeeping here. So we're using Zoom today. I invite you to put your questions throughout in the Q&A feature of Zoom. We'll have time after the presentation to field your questions with the presenters. Also, I'll note that this session is being recorded and the link will be sent out after. So you can access the recording and the slides will be posted on our website as well. I do want to draw your attention to the upcoming webinars in this series, one in July that's focused on promoting economic stability to reduce child maltreatment through the Earned Income Tax Credit, so evaluating a policy approach. And then we'll have a session in September looking at gun violence as an adverse childhood experience. These are available on our website, and I will send the link after the session today so that if you're interested, you can register for those as well. We'd like to start with a poll, so please take a moment and tell us what sector you work in so that we know where everyone is coming from today. Great, I see lots of votes coming in. I'll just give it 10 more seconds. Okay, looks like most everyone has voted. So let me share these results so everyone can see. So we have 37% of folks coming from public health today, 8% from healthcare or clinical settings, 19% from social services, and 29% from nonprofits and community-based organizations. So great. Well, thank you for sharing that. Nice to see a mix of folks. The purpose of this series is to share research throughout. This study that our presenters will be sharing today is in the earlier stages, but it's a great opportunity to learn about the exciting work that's happening on preventing ACEs and child maltreatment prevention at different stages. So now I'm going to introduce our presenters. We have Dr. Luciana Assini-Mayton, who's at Johns Hopkins University. She's an assistant scientist at the Moore Center for the Prevention of Child Sexual Abuse at the Johns Hopkins Bloomberg School of Public Health in the Department of Mental Health. And her research efforts concentrate on understanding the impact of trauma experienced in childhood on later life experiences and how these impacts may vary based on individuals' social identifiers and circumstances. She has a PhD from the University of Maryland School of Public Health. So thank you, Luciana, for being here today. And then I will also introduce Dr. Catherine Soul. She's the Youth, Families, and Communities Advisor with Cooperative Extension of San Luis Obispo County in California. And her work aims to improve people's quality of life, ensuring the incredible research and knowledge of the UC campuses helps the people of California live better lives. And she holds a PhD from the University of Georgia. So we're so thankful to have you both here today. And I'm going to turn it over to Luciana now to get us started.
Just gonna share my screen here. Okay. Thank you so much for the introduction, Sarah. And hi, everyone. It's a pleasure to be here today along with Dr. Catherine Soul to present and discuss some of our ongoing research to evaluate organizational policies to address and prevent child sexual abuse. First, I would like to begin by providing you with an overview of what you can expect in the next hour. We will begin by acknowledging all the main people who have directly contributed to this project. Second, we will provide a brief overview of the extension of the problem of child sexual abuse in youth-serving organizations. We will then go on to talk about our first project on the characterization of prevention efforts. We will then discuss our ongoing project on the evaluation of child sexual abuse prevention in youth-serving organizations. Finally, we'll talk about what's next for us in terms of dissemination of findings. We will then open the last minutes to any questions and comments you might have. So I want to recognize our project collaborators, partners, and funders that made all the work we are presenting on today possible. On the left, we have this group of amazing people that are our academic collaborators. On the right of your screen, we have another set of amazing people from the organizations that we partnered with. We gladly have Dr. Catherine Soul from 4H with us today. Our work was made possible with funding provided by the Bloomberg American Health Initiative and from the CDC. So we know that child sexual abuse most often happens in the home of the person who is being victimized or in the home of the person who is engaged in the harmful behavior. However, we know that child sexual abuse knows no boundaries and also happens in institutional settings. And these include recreational clubs, schools, churches, or other places of worship, and etc. Some studies have attempted to quantify the extension of the problem of child sexual abuse happening in organizations. And we brought here 3 examples of these studies. So the first study was a review of sexual misconduct by educators in the US, and it was identified that approximately 10% of students reported experiencing sexual misconduct by an educator in schools. So this proportion is higher than the other studies that I am discussing next, because it included behaviors such as unwanted sexual attention and sexual harassment. So the next study that I am showing here, it was also conducted in the US with a sample of over 13,000 children under the age of 18. And it was identified that a little under 1% of respondents reported experiencing child sexual abuse in the context of organizations. While this 1% does not seem a very large number, this translates to a population estimate of about 36,000 children. And this specifically study was conducted with children ages 0 to 17, and of course their parents for children that were ages 9 and younger. So it is still possible for the victimization numbers still to be higher. So specifically for this study, this prevalence reflects either touch or forced sex by a grown-up from some organization, such as a teacher, coach, or youth group leader. Third, I brought here, just for reference of estimates outside the US, a fairly recent study conducted in Germany that estimated about 3% of their adult population have experienced child sexual abuse in an organizational setting. This prevalence reflects non-contact sexual abuse, such as exhibitionism, and also contact sexual abuse, and includes a broad range of institutions, such as schools, religious organizations, sports, and etc. The issue of child sexual abuse in a variety of organizational settings, they have been recognized, and some youth-serving organizations have begun to formally address these issues already for decades. So for example, Big Brothers Big Sisters of America have formally started to address this issue already in the 70s. Today, many youth-serving organizations implement several measures to protect children, and these measures influence several aspects of their organizational practice, from screening and hiring new employees, training staff and volunteers, developing and implementing code of conducts, making modifications to the physical setting, you name it. While certain organizations implement several measures to prevent and respond to child sexual abuse, we still don't know the full array of these safety measures. To address this gap, we developed a study to characterize child sexual abuse prevention efforts in partnership with 4 large national-based youth service organizations that I mentioned before. So we partnered with 4-H, Big Brothers Big Sisters of America, Boys and Girls Clubs of America, and the YMCA. The reach of these organizations is very large. Collectively, they serve approximately 20 million children per year and have about 2 million staff and volunteers. So to complete this characterization of prevention efforts, our partner organizations provided us with approximately 161 documents. And these included organizational policies, training manuals, codes of conduct. We screened these documents and completed a qualitative analysis of 78 of these documents. Throughout this qualitative analysis, we identified almost 1,500 components of child sexual abuse prevention strategies that have been described by these organizations, which we classified into 8 overarching themes that I'm going to explain next. To inform this work, we also reviewed 5 sources of recommendations that are already published. So we reviewed the guidelines to prevent child sexual abuse in organizations from the CDC that was published in 2007. These guidelines are currently being revised. We also worked with the report from the Australian Royal Commission into Institutional Responses to Child Sexual Abuse. We worked with Commit to Kids, that are guidelines to prevent child sexual abuse in organizations. We also work with the situational prevention model and with the ecological perspective. So these are the 8 themes that we work with, that we use to index the prevention strategies that we identify in the organizational documents. These themes represent key areas to address, or that are recommended to address when preventing child sexual abuse in organizations. So these areas or themes include an overall commitment to child safety by the organization, development of codes of conduct, training and education, assessment, implementation and monitoring of strategies, screening and hire measures, policies and measures on how the organization report and respond to child sexual abuse, how the organization prevent and address youth problem sexual behavior. And we were also interested in whether the organizations had any guidelines for the cases where there is not a lot of age difference between the participating children and staff and volunteers. So the first theme addressed the organization's overall commitment to child safety, what that meant. This theme was defined by the inclusion of statements expressing the organization's commitment to implementing measures that decrease the likelihood of a participant being abused by any member of the organizations. So we identified 8 sub-themes within this main theme. And these 8 sub-themes included commitment to child safety, commitment to fostering children's positive development, and commitment to child sexual abuse. 4 of these sub-themes were identified in the documents of most organizations. What does this mean? This means that these sub-themes were identified in the documents of 4 or 3 organizations, and 4 sub-themes are identified by some organizations, meaning that these sub-themes were identified in the documents of of 2 or fewer organizations. So in the interest of time, I cannot go over each subteam. So I will give you one example of each. So in this case, most organizations include in their policies clear statements to their commitment of creating a positive environment for children, an environment that is free from violence, abuse, harassment, and discrimination. And we also identify that some organizations included in the policies a commitment to child participation in the development of policies. The second theme addressed codes of conduct, which described a set of behavioral standards around what is permitted, what's required, and what is forbidden. This for staff and volunteers, children, and also parents. We coded 12 subteams. And these included guidelines around physical and verbal contact between staff and volunteers and children, overnight activities, electronic communication, one-to-one interaction, among others. So as an example, most organizations included in their guidelines, including their documents, guidelines around inappropriate relationship between staff and children. And they overtly specify that staff and volunteers cannot date or become in any way romantically involved with children. They cannot keep secrets with children, and they should avoid displaying favoritism to any specific child. We also find that one subteam was within identifying the documents of some organizations around how to communicate with parents regarding problematic child behavior, and also overall how to communicate about organizations' policies and procedures. This team, training and education, was defined by measures aimed at increasing board members, administrators, staff, volunteers, children, and parents. So all the main key stakeholders of the organization, awareness, knowledge, and skills related to child sexual abuse prevention in organization. We coded 4 subteams, and they were all identified in the documents of most organizations. And these included things like training about child sexual abuse facts and prevention, training about the organization's code of conduct, and training on how to report and respond to child sexual abuse. As an example here, we have that most organizations provided training on their code of conduct and require that staff acknowledge such code and agree to abide by it. For assessment, implementation, and monitoring, we identified 6 subteams, and results indicated that most organizations addressed 4 of these subteams. As an example, most organizations described their quality assurance protocol, which included the establishment of a board in charge of overseeing organizational and ethical compliances, and also the use of self-assessment tools for staff to self-check the quality of their work. Also, as an example, we have that some organizations describe in their documents measures related to creating a physical environment that would allow for a clear line of sight when monitoring children. So this team that is screening and hiring measures, it related to the identification of prospective volunteers and employees' characteristics that might increase the likelihood of engagement in sexual behavior with a child. So here we coded 4 subteams. As an example, background check in criminal history was identifying the documents of most organizations. And in another example, we have that some organizations really describing in a lot of detail how to conduct interviews with prospective staff and volunteers. Our 6 teams included how to report and respond, descriptions on how to report and respond to child sexual abuse. 4 sub-teams are coded within these teams, and they are all identified in the documents of most organizations. So one example here included how the organization deals responds to child sexual abuse. Examples included suspended the accused staff or volunteer, contacting insurance companies, legal counsel, or crisis management, and ensuring that there is no retaliation against individuals involved in the allegation of or the investigation. And these policies also describe the child-centered response to strategies, including providing counseling for the child and their family, and providing other forms of reparation to the child when appropriate. Finally, our themes 7 and 8. So for these 2 themes, we identified less contact if we compare to the other themes. So youth problem sexual behavior included guidelines or policies for staff and volunteers regarding what is appropriate and inappropriate behavior between children and how to respond to inappropriate sexual or harmful behavior. So because we identified much less contact in here, there were no sub-teams. And some guidelines described how staff and volunteers should intervene to stop behaviors, notify a supervisor, and the children's parent. For boundaries for teen young adult staff and volunteers, it included statements describing any aspect of the teen leadership programs and youth in staff or volunteer positions. So again, we identified no sub-teams, and as an example, we identified that some organizations specify that children in teen leadership programs should still be considered participant children and abide by those regulations and not considered staff and volunteers. So before we move on, I just have some considerations. So we examined only a portion of the prevention materials created by our partner organizations. So there may be strategies included in organizational policies that were not captured by these broad characterizations that we attempted to do. Another limitation is that it was beyond the scope of this project. It would be very nice to do, but it was beyond the scope of this project to identify the extent to which these organizations regularly employ these strategies, and whether there is any homogeneity or discrepancies in the employment of these strategies across the whole organization. And finally, in this project, we have captured prevention strategies only in large national-based organizations. So we acknowledge that these approaches may vary or be different based on organizations' locations, resources, or different missions. So I will leave you now with Dr. Catherine Soul, who will discuss some implications for practice.
Thank you very much. So I want to just start by giving a little bit of information about 4-H and the Youth Development Program for those of you that aren't aware. 4-H is over 100 years old, and it has become the nation's largest youth development organization that is research-based. Our focus is really to help young people and their families gain skills that they need to be proactive in their communities and develop ideas for innovation. Today, 4-H serves youth in rural, urban, and suburban communities in every state across the nation. And 4-H happens in out-of-school programming, in school enrichment programs, clubs, and camps. And we are really looking to engage youth that are ages 8 to 18 in our traditional 4-H program. And then we have a program called 4-H Cloverbud for youth that are ages 5 to 7. Next slide, please. Thank you. So I want to just share some of my perspective. Although I participated in this project, with a national focus, I want to share kind of my personal focus as the Director of Cooperative Extension in San Luis Obispo and Santa Barbara counties, which includes 2 large county-based 4-H programs. 4-H at the national level is administered through 100 universities, and each has their own structure and policies. So I think it's important that we recognize we can't evaluate sexual abuse prevention practices of the organization as one whole entity. So applying the research that we've done at the national level, looking at these practices from a higher level perspective, I want to share some examples from my own programs. So in my own programs locally, we serve over 15,000 youth annually, and we partner with nearly 1,000 volunteers, as well as hundreds of youth leaders. And these volunteers and youth leaders deliver the majority of our educational programming. Our programs are run through a variety of formats and settings, which can include overnight camps, overnight trips, in-school programming, after-school programming, programming at community sites, and programs at volunteers' homes. So from this perspective, each of these sites and delivery modes needs to be evaluated individually in order to determine the strengths of our existing policies, as well as areas for improvement for our sexual abuse prevention strategies. Next slide, please. So when we think about those themes that were presented from this research, I want to consider which of these which of these are our areas of strength, and then which ones give us an indication of where we could improve our existing sexual abuse prevention strategies. So there was a few areas where, based off of this information that was presented, I would say that we have strengths and that there's no improvements necessary noted by these review findings. And that's in the areas of training and education, as well as assessment, implementation, and monitoring, and then reporting and responding to child sexual abuse and youth volunteers. And there was 3 other areas where we are engaged in these practices, but I do see that there's a potential room for improvement. And so some of these are the overall commitment to child safety. And from the findings of this research, I think that we may be able to improve our commitment to child safety by involving children in the formation of our policies, ensuring that children are represented across all areas of decision-making, and recognizing our youth's readiness to engage as partners in these efforts. Additionally, we have strong codes of conduct to prevent sexual child abuse within our organization and programs. However, I think that these codes of conduct could be developed and improved after participating in this research by having tools and training to enhance our staff and volunteers' communication with parents, so that we are providing training about how to communicate about concerns regarding problematic behavior, as well as potential and prevention of sexual child abuse. And then finally, in terms of screening and hiring measures, we do have extensive screening and hiring measures, including Department of Justice background checks and live scans. However, one area that I think we could improve on based on the findings of this research project so far is by interviewing prospective staff and volunteers through a lens that is looking to identify characteristics that can increase the likelihood of a particular individual's possibility of engaging in sexual behavior with a child. So while I appreciate the research that lets us have a national level review of our policies, I think that we do have additional work that could be utilized to ensure that these practices are appropriate and are being applied uniformly across all of our program sites and delivering modes. Additionally, I think another area of challenge for us is just recognizing that monitoring compliance is extensively more difficult when the program is led by a volunteer, majority volunteer educational force. And in my personal experience with our programs, because we don't have team members on site for the majority of our programming, most of the issues that we do become aware of around any form of policy compliance, whether it's related to child sexual abuse or any other any of our other policies, is generally brought forward by other volunteers and caregivers. So I think that's an additional area that we need to be aware of when we're thinking of and I will turn it back over to go into another aspect of our research.
Thank you so much, Dr. Catherine Sol. So our second project, it had the main goal to evaluate the effects of youth-serving organizations' modern CSA, child sexual abuse prevention efforts on youth safety. While we know that youth-serving organizations have been implementing prevention strategies and addressing child sexual abuse in these organizations, there is still no evaluation on whether there is a reduction in child sexual abuse over time as a result of such measures. So to begin to answer this question, we are currently developing a national survey with approximately 9,000 adults who had some exposure to youth-serving organizations while growing up. So this is an ongoing project. We are currently in the stage of survey development. Therefore, I don't have any data to show you, but I want you to have a sense of what we are doing. I just want to acknowledge before we continue that I will discuss next the assessment of grooming and child sexual abuse victimization, which will entail the description of some of these behaviors. And this might be disturbing for some individuals who have experienced grooming and sexual abuse. One of the concepts that we are trying to assess in this national survey is a concept of grooming that might have happened in the context of organizations. Many individuals who sexually abuse children precede the abuse with behaviors designed to, let's say, soften the young target, often characterized by actions that build trust and behaviors that represent gradual boundary violations. We are going to try to capture some of these behaviors when assessing grooming. Our complete list of grooming behaviors include a little over 20 items. So here I have a few examples that include tickling you, confiding personal things to you, giving you beer or liquor, inviting you to skinny dipping, asking you to talk about sexual things, and meeting you outside the organization's programming. These are, so there are few assessments of grooming behavior out there, and the one instrument that we base these items off is the Modus Operandi Questionnaire by Keith Kaufman, who is also a collaborator in our study. And one key difference here is that the Modus Operandi Questionnaire is used with individuals who have committed child sexual abuse. So we know that these behaviors were used with the intention of facilitating child sexual abuse. In our case, we are trying to assess grooming by the perspective of the potential victim. These behaviors per se might not constitute grooming. So even though this is not perfect, to come around this issue, we added a follow-up question to try to identify whether these behaviors preceded child sexual abuse. So we are going to follow up each one of these items with, did that person ever actually do or attempted to do sexual things with you? We will also include some items on grooming of the family, and some examples are offering to babysit you or your siblings to help out, creating a friendship with one or both of your parents or caregivers, taking the family out for dinners. Again, this is the few examples. We have about 10 or 15 items in here. And also, these behaviors might not constitute grooming. So to address this issue, we'll follow up with the same item that I have shown in the previous slide. And finally, we are also trying to assess the use of technology for grooming. We will have some items on whether any adult staff member of the organization contacted the participant by calling them on their cell phone, by using emails, online chat programs, and reaching out via social media. The second major concept that we want to assess is child sexual abuse victimization. There are several different ways of assessing child sexual abuse based on different conceptualizations of what child sexual abuse is. It is beyond the scope of this presentation to explore each one of different variations in conceptualizations, but just to give you an example, there are some assessments that add an age difference between the child and the person who committed the abuse. These assessments will ask when the participant was younger than 18, whether someone at least 5 years older have done the following behaviors that then constitute child sexual abuse. This is one way of assessing child sexual abuse that is still used today in several assessments. But of course, when we use this type of assessment of measure, we are missing here when the cases when the abuse was perpetrated by someone close in age. For this survey, we are going to be assessing child sexual abuse victimization with 4 screeners that will range from looking at private parts, touching private parts, attempted forced sex, and forced sex. We will be assessing child sexual abuse victimization and also grooming in a variety of organizational settings. And these will include youth-serving organizations, schools, sport organizations, religious-based organizations, and foster care. We will also include questions of abuse by family members and others not included in any of the categories above. So we will not single out any particular organization. When we do these assessments, we are going to have broad categories of types of settings. And also in the current form, we will have an assessment of abuse perpetrated by an adult in an organization and also abuse perpetrated by other kids in these organizations. So I will leave you now again with Dr. Catherine Soul for a discussion of some implications of this research.
When I'm thinking about the implications for the results of this survey, knowing that we don't have actual data yet, I decided to put on another hat for thinking about implications. In this case, I'm thinking about our SNAP Ed funded CalFresh Healthy Living program. And this program exists again in every state across the country and in nearly every county in the country. And SNAP Ed is really focusing on supporting healthy and active lifestyles by teaching individuals, including youth and family members, about good nutrition and how to stretch our food dollars while also building partnerships in the communities to help the ability for people to make healthy choices the easy choice. In California, this program is run through the University of California and Cooperative Extension, and we seek to provide comprehensive evidence-based nutrition and physical activity education that connects with policy system and environmental change services in early childhood centers, schools, and community environments. In the state, services are provided in 32 counties with staff, as well as 3,000 volunteer extenders, which can include teachers, after-school staff, and community members. In this work, we are really moving towards programs that allow us to do interventions at a comprehensive level, working in community sites and building youth engagement. Next slide, please. Locally, our program in San Luis Obispo and Santa Barbara County runs 2 programs that don't necessarily happen within the context of a school or summer school or after school program. And these include our UC Garden Nutrition Extenders, where we train volunteers to help support community gardens and work with youth to maintain those gardens, learning gardening behaviors, and ultimately learning how to make nutritious food, as well as our 4-H Student Nutrition Advisory Councils, which are run by our nutrition educators, and they do operate as a club setting. And so I think there might be some interest into, well, why are we talking about a nutrition programming in this presentation? And that's because we're really focused on youth engagement and youth development strategies to support youth in building advocacy skills, presentation skills, and as well as helping them to identify potential college and career pathways. At the same time, our programs are led by educators and volunteers. This program, unlike the 4-H program that we were considering before, has much fewer policies and procedures that focus on the prevention of child abuse, because these programs are new models for engaging and supporting youth and moving into a new direction. So I think that this is an opportunity to really help us raise awareness, as well as to inform the development of policies based off of best practices and types of information that will come out of this survey. Next slide, please. Specifically, when we're thinking about awareness of grooming behaviors, understanding what grooming behaviors are and the frequency at which youth may be exposed to grooming behaviors is a very important concept to be aware of when we are building youth-adult partnerships. Youth-adult partnerships are based off of building trusting and caring relationships between youth members and adults, which is a key element of youth development programming. However, we also need to be aware that these trusting relationships can be misused for grooming behaviors. So by reviewing the survey results and having the opportunity to have these discussions within programs, we can help our team become more aware of what to watch for when working with other educators and volunteers. We can help our educators understand what behaviors that they need to avoid, as well as to be aware of what may be considered grooming behaviors if our youth members are confiding in our educators about things that are happening to them outside of our program in other areas of our lives. Additionally, the use of technology, and I saw there was a comment in the chat box about COVID, and for my team right now, I think that technology and thinking about it in the context of preventing child sexual abuse is really relevant, because the COVID-19 pandemic has required that a good deal of our programming needed to move online. So when we look at the implications when we look at the potential implications for this survey, I'm curious how we'll be able to use information to help us develop appropriate policies and procedures around technology use when programs do need to move online, as well as thinking about how can we have these conversations to help our youth and participating families build awareness of grooming behaviors that may happen online, so that we can help them support prevention within and outside of our programs. There was also discussion about child sexual behaviors between children, and as well as in different settings. And I think that this is particularly important when we think about a program that, like ours, where we have things like traveling in a large van where we can't see all of the children in their hands at all the times, when we take youth on overnight trips and camp environments, when we have restrooms that are multi-stalls that multiple youth are using at the same time. I think this is really important for us to be aware of what types of behavior between children that is sexual child abuse, and how do we competently respond to address child sexual behaviors? How do we engage the families? So I think that this survey can really help us start to consider some of these really important questions that doesn't have a ton of research behind it right now. And I also think it's important to just be aware of places where we may experience resistance within youth serving organizations that may come from a lack of awareness. So surveys like this can really help build awareness around the actuality of what youth may be confronting in youth serving organizations, as well as individuals' lack of comfort talking about these subjects. and a need to expand our background checks going beyond Department of Justice and LiveScan, really helping to explain why it's important to do some of those more focused survey questions. So I think the survey results will provide a lot of opportunities to help improve youth serving organizations. Prevention of child sexual abuse.
That. Thank you so much, Catherine. So here are some next steps for our program of research. We are currently developing a leadership desk guide with a few overarching principles that we believe are key for leaders in youth serving organizations to address, to prevent child sexual abuse in organizational settings. We are trying to have this in a format that can be used by leaders from organizations with a broad range of characteristics, from small organizations to large, and also organizations with different missions. We want this guide to be as practical as possible, something that people in organizations can really use and implement. Our idea is to have this desk guide built in a website so that the information can be interactive and also user-friendly. So this is a work in progress, and stay tuned for further developments of this project. So this comes to the end of our presentation. We very much appreciate your time and your attention. And Dr. Sol and I are here to answer any questions that you might have.
Thank you both so much. This is Sarah Brandspiegel again. I appreciate your presentation, and a very important topic for youth serving organizations. And I want to invite everyone to put any questions into the Q&A box. I will start with one, which is about the timeline. We had a question about being able to access the survey results when those are ready. And so I wondered if you could share a bit more about your anticipated timeline for your survey and your desk guide.
Sure. So for the survey, we are still developing the instrument. It's going to still go through all the process of refinement and then pre-testing with individuals. We are looking at launching the survey still this year into 2020. So we are most likely going to start to have preliminary results at some point in 2021. For the desk guide, I'm hoping that this is going to be sooner. We don't have a date yet for launching the website, but this is something that I'm going to send it to you, Sarah, and when we have the website ready for you to share with people that are interested.
Wonderful, thanks. Another question I'm curious about, just backing up a bit, is what is known about organizational approaches, and is there evidence on best practices for preventing sexual abuse in organizations more generally beyond youth serving organizations? What do we know about that from the literature?
Sure. So we have several guidelines, and some of the guidelines I have presented in there when I talked about the methods that we are using. So we have guidelines from several countries, we have models, but to my knowledge, there is not yet any evaluation of the effectiveness of these measures, even in schools or other types of organizations that really have shown a reduction in child sexual abuse. I mean, child sexual abuse has declined significantly overall since the 90s, but this is of course another question to ask, is whether there is also a reduction that is due these measures that have been implemented and recommended.
Okay, great. Thank you. Another question came in again about the survey that you're planning. Can you say more about who will be surveyed, the age of the participants, and any challenges you anticipate in terms of your ability to get information from your survey participants?
Sure. So we are looking now at cohort who was born between 1992 and 1990 in 2002. So this is the cohort of more younger people that we are looking at. So for recruitment, we have partnered with Qualtrics, and they have a national panel. So they will do the recruitment within this panel that they already have. And of course, one issue, not issue, but one concern that we have here, we need to have a certain proportion of children who have, participants who have experience in youth serving organizations. So we are going to work with some quotas to have at least 40 to 50% of participants who have any exposure to youth serving organizations programming.
Okay, great. Thank you for that. So your respondents will be adults reflecting back on their experiences as children.
Exactly.
Is that right?
Exactly.
Okay.
Exactly.
Okay.
We will not be contacting any children. Everyone is going to be age 18, at least.
Okay. Great. Thank you for that answer. Other questions, feel free to enter them in the Q&A box. I guess I have another question that maybe is more for Catherine. I'm curious, you all mentioned this idea of engaging youth in setting organizational policies. And I wonder if you could say more about that. And does that happen in regards to other types of policies? And what does that process look like? And how would you envision that unfolding when it comes to these types of policies?
Great, yeah, thank you. And that was something that came out of the first component that we were discussing in terms of the research at looking at larger organizational policies and practices. And that's something that we currently don't do in the programs that I oversee. And I feel there's a lot of value in it. We do have youth voices as part of our decision-making team and our leadership in our programs, both at a community club level, so a smaller group of youth, all the way up through our state and national organizations. So I think that it's really important to have youth perspective. And I would guess that we haven't had youth participate in setting these kinds of policies and contributing to these conversations because of the uncomfortability around the topic. And even the idea of even engaging youth in these conversations may feel that it's too sexual to have a conversation with youth about sexual abuse. Would having that conversation with youth potentially be sexually abusive towards a child? So my guess is that those kinds of questions is what has prevented some organizations from engaging youth in this kind of decision making and leadership for setting policy. However, if if you're working with older youth, particularly our teens and young adults, I think that it would be really important to include that youth perspective, particularly because folks that often set organizational policy are looking through a higher level lens that may not encompass the actual day-to-day experiences of what happens in a youth serving organization the way that a youth would. And having youth perspective can really help inform what may actually be happening, as well as how to engage youth and families in preventative strategies.
Thank you. One of our participants, Sarah, had a follow-up about survivors' role in policy setting. So going beyond engaging youth, but really looking at survivors and giving them a voice in this. Is that something that you've seen unfold in any organizations, or is that something that you'll be learning about?
Luciana, do you want to go first?
Sure, that's a very interesting question. So there is this the Australian report that I just mentioned, they interviewed thousands of survivors of child sexual abuse in organizations in Australia. It was a very, it made very in-depth interviews. It was a quite interesting project. And from those interviews, they developed those guidelines and this main document that constitutes this royal response to child sexual abuse in organizations. So I do think there is a very important role of survivors in developing these policies.
And I think that the second component that was presented on around the survey will really help elucidate some of the survivors' experiences and help organizations make decisions around policy with that information available. I also will just say anecdotally that I have noticed that folks that are most passionate and engaged in this work are often survivors, and bring that lens to the organization that they're working. But that's, you know, again, an informal pathway to policy development. And I agree with this question from the audience that survivors should have a role in policy setting, as well as survivors' caregivers.
Great, thank you. Another question came in about the themes that you presented and whether that information is available for folks who may want to know more, since you gave a broad brush overview of some of the themes and sub-themes that emerge, but is there a place that people can go to dig a little deeper into that data?
Sure. So we have a report and we have a publication that we just submitted for peer review. So I hope that's going to be coming out this year. So when that publication comes out, I'll certainly send out to you for broader sharing.
Wonderful, thank you. Well, we are almost out of time. I think we have time for one last question. And I think, you know, it'd be helpful to know, do you have a sense for the leaders of these organizations, the extent to which that they feel that child sexual abuse is a problem that they need to address? Is this a priority? Do we know anything about how they're coming at this issue? And what are some of the drivers for these organizational leaders to be thinking about this topic?
Do you want to go first, Catherine?
Sorry, I was on mute. Yes, I'd be happy to. I think the fact that, you know, with just the 4 organizations that we worked with, that we had over 160 documents to analyze, and, you know, over 1,500 or over 1,400 components of prevention and intervention, says how serious organizations, at least at these large organizations at the national level, are investing in this conversation, and the consistency with which the practices revolved around, or the information revolved around the same practices and policies. I think that there is a true interest and care and recognition that these issues do happen, and that we need to support our youth and do the best preventative policies that we can. So I think that's huge. I think there's also another component that is important for organizations to consider, and also influences some of these policies, which is around you know, risk management and liability. So I think that those 3 things combined, the true knowledge and care for wanting to prevent this from happening, as well as the legal obligation to do so and consequences if we don't. I think all of that, you know, is combined to help organizations put a lot of effort into developing these policies.
Yeah, I agree with Catherine. That was a very comprehensive response.
Wonderful. Well, thank you both so much. We really appreciate your time and your presentation today. And for everyone who joined us today, as you leave, you'll have access to a feedback survey, a very brief survey to give us a little feedback on the session today. And also keep an eye on your email where you'll receive the slides and the recording link as well. And please join us for future webinars in this series. Thanks, everyone. Have a great day.